Welcome to today's broadcast. My name is Colleen Patterson, and I am the Director of Employer Services and Compliance at Savoy. Yesterday, Wendy Ebner focused on carrier allowances and changes in rules in the New Jersey market. Today, we are focusing on the Pennsylvania and Delaware markets. So to address these questions, I am joined by Chris Handley, who is the Regional Director for the Pennsylvania and Delaware markets at Savoy. Chris, what do brokers need to know about carriers in your market?
Well, thank you very much, Colleen, for the opportunity to speak today. And first and foremost, I hope everyone who is listening is healthy, that you're taking measures to stay healthy. I'm sure that we will all get through this together. We're a pretty resilient group of folks, and my thoughts and prayers are with every one of you. And we very much appreciate your partnership. So there are some updates with all the major medical carriers in Pennsylvania and Delaware. And of course, this list of actionable items that we can take to help our clients, well, it ebbs and flows, right? And I implore everyone to make sure you're staying on top of our quick flashes that we send out every evening, and reach out to the appropriate Savoy team member for the latest. But what I'd like to do is talk on a high level, particularly as it pertains to new business and also retention of your existing business. And I'll try to do this in alphabetical order. So again, we'll start with Aetna, and we'll probably end with United Healthcare, if that makes sense. So when it comes to small group new business submission extensions. So I think the carriers realize that sometimes it's going to be a little more difficult to get all the information you need to submit a new group for installation. Aetna's done something pretty formal. For example, for a 4/1 effective date, which of course we're right up against, the notification of the sale would need to be by 4/3. So at that point is when you would tell your appropriate Savoy associate team member that yes, this sale is going through, and then we would take our actionable item on our end. And then the complete submission would need to be done by the 10th of April. And you'll find that for May, it's very similar. The notification of the sale has to be in by the 4th of May, and the complete submission has to be in by the 10th of May. I just don't want anyone to be confused. This is not the date that we need the initial applications to receive medical underwriting and that type of things. Those dates have not changed, although I will tell you that we will work with you in Aetna to be flexible with that. Same thing regarding new business submission extensions. When it comes to Cigna, they have no formal rule, but informally, and I verified this today, that they will work with us. So we'll take it on a case-by-case basis. So what I would say again is work with your team member at Savoy, and we will work to get any exception that we need that's within reason. Same thing goes with Highmark Delaware. Same thing goes with Independence Blue Cross. I know they're going to be flexible, but they're not going to make a steadfast blanket rule like Aetna did. So again, try to get everything in on time. We certainly need to get it in before the effective date, but they'll be flexible. United Healthcare, they've always been the most flexible. So whether we were talking about COVID-19 or not, the bottom line is, and this is a standing rule with United Healthcare, not that I recommend it, is that new business submissions, for instance, for a 4/1 effective date, they don't need to be submitted until the 8th of April. Again, not something I recommend, not something that we want to do unless we absolutely have to, but United Healthcare is pretty flexible. So when we talk about the administration or the maintenance of a plan, there's a lot more questions, right? A lot more moving parts to it as well. And the first thing I'd like to go over is off anniversary exceptions. So Aetna, very surprisingly, in the Aetna AFA and fully insured markets up to 100 eligible, they are going to allow off anniversary plan downgrades through July 31st, 2020. Businesses that temporarily close will be allowed to continue their AFA plan as well, provided premiums are paid monthly based on the assumption that the business will reopen after the COVID-19 pandemic. Now, what I would say about this off-cycle downgrade is that you have to work with the appropriate account manager or team member at Savoy, because it's not a simple process. For instance, Springboard is not going to be opened up again, so it's important that you work in collaboration with us so that we can work in lockstep with Aetna. Regarding off-anniversary plan exceptions, again, Cigna is looking at it on a case-by-case basis. I verified that about a half an hour ago. And they do that even outside of COVID-19. So again, it's not something that we want to get in the habit of doing, but regardless of COVID-19, Cigna always looked on this on a case-by-case basis, but it would go through the normal underwriting process. Highmark is kind of put a hard line in the sand. What they're saying, which is not really incorrect, is due to the Affordable Care Act requirements, they are not able to permit changes sooner than 60 days. So they're taking the letter of the law very literally, which I understand. So they are not really entertaining off-cycle downgrades. From Independence Blue Cross, there's nothing of specific guidance at this time, but again, these things evolve. United Healthcare is taking a kind of a different approach. What they're doing is that they're providing fully insured small business and key account clients with a special COVID-19 open enrollment opportunity. They can, if the employer agrees to this, if all parties agree that this is something they want to do, they have an opportunity to enroll employees who did not previously enroll in coverage. It's important that to let you know that this opportunity is limited to employees who previously did not elect coverage for themselves, spouses or children, or waived coverage. This opportunity will extend from March 23rd, which is already passed, through April 3rd, 2020. So the end of this is actually coming up. Another question that comes up is, what are we going to do about employees that are furloughed or laid off, or temporary laid off, I guess I should say. There's special rules, right, depending on the carrier. So Aetna, and again, we'll do this in alphabetical order. Aetna, for furloughed, or in layman's term, a temporary laid off employee, and those with a reduction in hours will be temporarily allowed to stay on the medical plan, provided premium payment continues and the option to remain insured is offered to all impacted employees. So again, that's high level. Work with your appropriate team member at Savoy, but there is an opportunity. At Cigna, what they have said, their guidance is that if an enrolled employee working 30 hours or more per week is furloughed or has hours reduced below 30 hours a week, Cigna will agree at the group's formal request to allow the employee to remain on the plan for the duration of the extended relief period, as long as the premium payments are made. And it looks like the extended relief period is through May 31st, 2020. And, you know, again, that may get extended as we move along down the line and we figure out how we're all getting through this together as a society. So Highmark in Delaware, they came out with a Q&A just, I want to say 2 days ago. And what they're saying is, for coverage periods through June 1st, 2020, they will waive active at work eligibility requirements for coverage for a period of up to 90 days from the date of the furlough or reduction in hours. Obviously, this is going to enable coverage for employees and members transition to part-time or furlough status. There are some specific requirements associated with it. So again, reach out to the appropriate Savoy associate team member. Independence Blue Cross, they will honor employer requests to continue coverage for employees furloughed or temporarily laid off as a result of the impacts of COVID-19. This exception applies to fully insured and self-funded business. This exception is in effect until June 30th, 2020. Again, at least for now. And they made it clear at this point, this exception will not be valid after July 1st. But again, stay tuned, more to come depending on how things go. United Healthcare, similar situation. Furloughed employees and those allowed with reduction in hours will be temporarily allowed to stay on the medical plan premium, provided payment continues, and that the option to remain insured is offered to all impacted employees. Employees who are laid off should be terminated from the group health plan and offered state continuation or COBRA. So again, that's good, I think, overall. Regarding premium grace periods, so the other question that comes up, right, is, hey, we're not really in business, and I own a restaurant, and there's no money coming in. How am I going to pay for these bills? So what Aetna has decided to do is they will work with the AFA plan sponsors, and this is Aetna AFA, to extend grace periods for the month of March, April, and May. The group must contact the answer team to establish the extension. Cigna, they're going to take things on a case-by-case basis. Again, no blanket rule, but they will entertain each situation, and we will need to submit a formal request. Highmark, same situation. I talked to the leadership there earlier today, and they're not making a blanket statement about what they'll do, but I am confident that they will be flexible for those situations where people can't honestly, where employer groups can't honestly pay their bill on time. Same with Independence Blue Cross, and same with United Healthcare. So we're probably not going to get too many more formal guidance on this, basically what we're saying is if we call in, we'll probably be able to get a more flexible payment plan than we've ever gotten before. So what about diagnostic testing and treatment for COVID-19? Good news is, as far as the diagnostic testing goes, the member cost share seems to be waived, again, to get the diagnostic testing for all fully insured customers, level funded. And I think really across the board from everything I've seen is that the diagnostic testing for COVID-19, those cost shares are waived. Where it gets a little more complicated is the treatment for COVID. So with Aetna, I'm very proud to announce, and I think they were the first ones. They are the first ones they are waiving cost sharing and co-pays for inpatient hospital admissions related to COVID-19 for Aetna's commercially insured members. And that's, I think, wonderful. Cigna is doing very much similar. They are waiving the out-of-pocket costs for diagnostic visits, for the testing visits, as long as they're FDA approved, and only a healthcare provider or hospital can administer the test, which I think makes sense, right? And Cigna is also waiving the out-of-pocket costs for all COVID-19 treatment through May 31st, 2020. The treatments that Cigna will cover are those covered under Medicare and other applicable state regulations. Again, there's additional details that you can get from your appropriate team member at Savoy, but overall, this is a very positive message. Highmark, looks like the cost share for treatment still applies, but again, stay tuned, that could change. Similar with Independence Blue Cross, the treatment, the cost share looks like it still applies. With United Healthcare is waiving member cost share for the treatment related medical expenses for COVID-19 through May 31st, 2020 for fully insured individual and group market health plan customers, Medicare Advantage and Medicare plans. They will work with self-funded customers who want to implement a similar approach on their behalf. So again, with all of these, I'm giving you a high level. There are some additional details that we would need to do before you give a blanket statement to your employer groups. But the good news is I'm optimistic that a lot of this cost sharing will be waived. A couple of other questions that come up, and Colleen, we're almost done. I appreciate your time. Is that regarding maintenance medications, Aetna is waiving the early refill limits on 30-day supply of maintenance medications. Cigna, effective immediately, they're extending prior authorizations to covered medications. That means that their customers with an active Cigna pharmacy prior authorization for traditional or specialty medications with expiration between April 1st and June 1st will automatically have their prior authorization extended for 90 days. Customers do not need to take any action as dates will automatically be updated in the system. Highmark's providing no additional guidance at this time regarding maintenance medications. Independence Blue Cross is waiving early refill limits on 30-day supply of maintenance medications, and so is United Healthcare. I believe the last thing I have, Colleen, revolves around telemedicine. Aetna is waiving the member cost share through 6/6/20. Cigna is waiving the cost share for telemedicine as long as it has to do in relation to COVID-19. Additionally, this is important, Cigna has opened up a 24-hour telephone helpline to allow you and your family members to speak with a qualified clinician about how to cope with anxiety, stress, or other issues related to the impact of COVID-19. That number is 866-912-1687. Highmark Delaware, regarding telemedicine. Their telemedicine and all virtual visits will waive cost sharing and co-payments for fully insured and ASO members under Teladoc, Amwell, or Doctor on Demand for 90 days. ASO clients also have an option to opt out. Independence Blue Cross, the members' cost share for telemedicine is waived through 6/1/2020. And with United Healthcare, telemedicine is available at no cost. For those groups, just for clarification, on the Oxford platform, say in New Jersey, members should contact their member services to request an online access code for telemedicine services. So Colleen, I know that was a lot and I probably took up more time than I was supposed to, but I think it's important and I really appreciate the opportunity to speak.
Thank you, Chris. That was fantastic, and I appreciate all the insight. For anyone who did listen yesterday when Wendy was on, obviously there is even more information available today. So as both Chris and Wendy have each mentioned during the broadcast, this information truly is fluid, and in some instances, it does change by the hour. So definitely, please be sure that you check out the resources that are available on our website at savoyassociates.com under the COVID-19 resources section. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources that we've mentioned. From all of us here at Savoy, stay healthy and safe. Thank you for joining us today.